So subsequent to a phone conversation where we've done a very high-level screening, we'll set up an intake process where a potential or a prospective patient will come in, sometimes by themselves, sometimes with a family member. You know, we encourage people to do whatever they're comfortable with. And we ask people to usually give themselves about an hour to an hour and a half for this process. And this is where we do a much deeper dive into, you know, both qualitatively, what are the symptoms, you know, what's presenting, what's the, you know, potential diagnosis, and then quantitatively, you know, what's the recommended appropriate level of care. You know, we're an outpatient treatment center. We have 3 levels of care within the outpatient spectrum. You know, there are inpatient treatment centers, there are residential treatment centers that offer an overnight component to their programs with 24-hour a day, 7 days a week nursing. This is something that we don't do. So, you know, in the intake process, we will, you know, very much be focused on identifying not just qualitatively what is it that is going on and do we think that we could potentially be helpful for you, but also quantitatively, you know, what's the appropriate level of care? Again, is it outpatient? Is it residential? Is it inpatient? And hopefully we've weeded out, you know, people who may need inpatient, you know, before you've come in. But sometimes we haven't. You know, we've got people that sometimes come in who, you know, say what they want to do is once a week outpatient, but they really need to be hospitalized. So this is the quantitative piece, and I think what's important for people to understand is in as much as we have tried to screen out people who are very unlikely to potentially be a good fit for our level of care, we can't avoid it altogether. And so, you know, here at SunCloud, there's, you know, never going to be a time where we're going to recommend a level of care based on either what's good for us or what fits us. So if we think that you need a higher level of care, because you can't really need anything lower than what we offer, except for nothing, you know, we're going to make that recommendation to you. Doesn't always mean that's what you have to do, but, you know, we really are going to be focused on making the best recommendation in the intake process that's good for you. Again, not what's good for us. As far as coming in for the intake process, you know, we want people to come in with their loved ones or family members, if that's going to make them more comfortable. We realize this is a pretty scary endeavor. Sometimes you have no idea where you're going. You don't know who you're meeting with, and I think that's an important piece for us, is that all of our intake people, all of our intake folks who do intakes are licensed, qualified therapists. So it's not, you know, 1-800 intake where you're going to get asked a million questions with no compassion, no understanding. The people that do our intakes are actual therapists, our therapists who see people in program, have been doing treatment, you know, for years. So again, when you come in with family, with a friend, whatever you're comfortable with. Bring an insurance card, you know, assuming you have a provider that you know, we work with. Bring your identification. We're required to ask you to bring those items in. And then, you know, if you have any collateral information from, you know, therapists that you're currently seeing, if you're coming from a residential treatment center and you have discharge paperwork that you might be able to bring in, anything that can help us as we're doing this, you know, qualitative and quantitative kind of evaluation of what is really the best for you. Can we help? Do we think this is potentially a good fit for you? We want all that information, if you can, when you come in, but if we need it subsequent to the intake, you know, we'll ask for it, and with your permission, you know, we'll get it. So when you're done with the intake, our hope is that not only will we have done a thorough enough evaluation that we'll be in a position, once reviewed by our medical team, to recommend A, whether or not this is potentially a good fit, and then B, what's the appropriate level of care? Is it with us or is it somewhere else? But also, as importantly, and we tell people this before they even come in, we want you to get a good feel for us, you know, and I think part of that is coming into the environment. Do you feel safe? You know, does it, you know, you'll see other patients, you'll see other family members. Does it feel like and look like a place that you would be comfortable with? Because again, although this is medicine, it's nuanced medicine, and at the end of the day, this is the type of therapy in medicine where you have to feel safe. And really, you can only really know that if you come in. So once you leave, not only will you have, been in the environment, but, with your experience and your conversation, the back and forth with our therapist, it's another opportunity for you to ask questions. And again, I think based on our therapist's response to some of the answers that you're providing, you'll naturally get a good feel for, again, whether or not you feel this is a good fit for you. Because with the lack of data, with the lack of outcomes, we know whether or not a patient is potentially a good fit, but we are acutely aware and very, very sensitive to the fact that most of the time our prospective patients, are coming in here blind. And we really try to do everything we can to empower you with that information so that you can make an informed decision about your medical care.